Good afternoon. This is Dr. John Bennett broadcasting for Larkin Hospital TV. Today we have the pleasure of having a presentation from the students at the North Campus. Is being directed by Kuriakose. And I'll let him introduce the speaker. Good day, Satish.
Right, thank you, John. Today, I want to welcome all of you to this good evening, and just had lunch, and I hope everybody is happy and relaxed. So we're going to start with a presentation by Ms. Nitya Murthy. She's going to talk on Parkinson's disease, and this project is part of a PowerPoint presentation project done by the students of the Neuroscience and Neuroanatomy class, MSc 530, Health Science Institute, and this course is conducted by the Biomedical Science Department. I welcome Ms. Murthy to start her presentation. Thank you.
Thank you.
Introduction, Dr. Kuriakose. As he mentioned, my name is Nitya Murthy. I'm a student in the Biomedical Master's Program, and I'll be giving a presentation on Parkinson's disease. So Parkinson's disease was described as early as 5000 BC in Indian Ayurvedic texts, as well as the Nijang ancient medical Chinese texts. The symptoms of Parkinson's disease include the resting tremor, bradykinesia, which is a slowness of movement, loss of coordination, the freezing of gait, anosmia, which is the loss of smell, difficulty swallowing, and cramping. We have a diagram to the right of the typical posture for a patient with Parkinson's disease. You can notice the tremor of the hands, even at rest, which is very typical of Parkinson's disease. It actually gets better when the patient is in movement. Persistent tremors of the hands and legs, the shuffling gait, the unbalanced posture, and the curved steps are all characteristic of this disorder. 1 million people in the US have Parkinson's disease, and 1.5 times more men have this disease than women, and it's more common in Europeans. So the average person with Parkinson's pays around $2,500 a year in just medications, and it costs around $5.6 billion in Social Security money to manage this disease. The reason for that is because it's not often caught until the disease has progressed to a worse state. As you can notice, are pretty typical of common aging symptoms. So it's not caught early, makes the treatment more dire. There are no specific laboratory or imaging tests that can confirm Parkinson's disease. There's no blood tests, and there's no diagnostic imaging tests. A PET scan can be used to examine the activity of the substantia nigra and the basal nuclei. However, this is not commonly done because it's fairly expensive. Oh, thank you. It's fairly expensive and it's not always accurate results. An olfactory test can be used because the loss of smell is one of the first symptoms of Parkinson's. And this happens because there's an accumulation of alpha-synuclein protein in the olfactory bulb. The accumulation of this protein happens not always in the brain at first. So if a person notices a lack of smell, the indication of this disease. However, most importantly, it's a family history that diagnoses disease. Presenting with tremors would go to the neurologist and he would ask the patient if their parents or grandparents had this kind of symptoms. And if that was the case, then it's most likely Parkinson's. A levodopa test can be used as well, which is the prescription of the levodopa medication in response to these symptoms. And if the symptoms are alleviated, then it's a pretty sure bet that it is Parkinson's. And it is diagnosed mostly by symptoms and the characteristic resting tremors. About the normal neuroanatomy of the brain and the part of the brain that's affected by this disorder. So the basal ganglia are a group of 4 nuclei which are involved in communication with the cerebral cortex and thalamus in order to coordinate voluntary motor control, procedural learning, and smooth muscle movements. The basal ganglia are 4 nuclei, as I mentioned, but the nuclei of interest are the striatum and the substantia nigra. They they are the ones that are most affected by this disease. The striatal output pathways, both direct and indirect, are controlled by dopamine secretion from the substantia nigra. The striatal output leads to inhibition of the thalamocortical neurons, which leads to control of movements initiated in the cortex. The striatum is responsible for balance, coordination, and walking. So we're going to look at that in a little bit more detail. We have here a diagram of the brain, substantia nigra, which is what gets degenerated as the disease progresses. In this, So in this diagram, we see what the normal interplay between the basal ganglia should look like. Dopaminergic secretions in the substantia nigra communicate with the striatum, which in turn communicates with the globus pallidus, which is another one of the basal ganglia nuclei. Communicates with the thalamus, which coordinates with the motor cortex.
Come closer.
And we have that pathway written out in a flow chart, so you can see how that goes. Substantia nigra releases dopamine, which communicates with the striatum. This communicates with the globus pallidus, which communicates with the thalamus, motor cortex, and that leads to decreased movement if the dopamine is not communicated to the striatum, which is what leads to the condition of muscle movements. Oh, this is working now. Parkinson's disease is a progressive and chronic neurological disorder in which movement is affected. It's caused in most part by a decrease in dopamine synthesis in the brain, and that results in adverse changes in the substantia nigra. It's thought to be caused by loss of neurons that release the dopamine in the basal ganglia. And the loss of particular monoamine transporter type 2, the BMAT transporters binding. So there are three types of dopamine transporters, the D1, the D2, and the D3, which are found on a subset of cells in the striatum, in the cerebral cortex, and the substantia nigra. The striatum receives excitatory input from several areas of the cerebral cortex, as well as inhibitory and excitatory input from the dopaminergic cells of the substantia nigra. The actions of both pathways regulate the neuronal output from the striatum, which in turn communicates with the thalamus, then the cerebellum, and then the peripheral nervous system, which is ultimately what causes movement. The cause of Parkinson's disease is largely unknown, but it's thought to be a combination of genetics, environmental factors, which are exposure to certain metals or chemicals, and oxidative stress of aging. The degeneration of cells in the substantia nigra causes neurons of the striatum to fire